So the next one will be group psychotherapy. Group psychotherapy is another type of therapy that has been practicing or has been implementing one of the choice at least other than individual psychotherapy. So basically, we've talked about psychodynamic psychotherapy, humanistic psychotherapy, behavioral psychotherapy, and what else? Cognitive and Gestalt, humanistic, and interpersonal psychotherapy. Now we're going to talk about group psychotherapy, slightly a bit different approach in therapy. Now, I've mentioned before that how complex is human being, and each individual of us have a very unique person. So human beings are complex creatures who share their activities or daily living with various group of people. We are social person, and healthcare professionals not only share their personal life with a group of people, but also they encounter or face multiple group situation in their professional practice. For example, team conference, committee meeting, grand rounds, and also in service session. But there are a few. So in psychology, we work with patients and families, and there's always the need to take a form of a group when we meet them. And the thing is about group psychotherapy is that we have the opportunity to reach out a group of them at one time, and those people who gather can help each other and share their feelings, ideas, experience, behavior, what they've gone through while they're dealing with those issues. So in other words, group psychotherapy is useful when patients learn from each other in a group setting. Okay, so by definition, group therapy is a form of psychosocial treatment in which a number of clients or patients meet together with therapists for purpose of sharing, gaining personal insight, and improving their interpersonal coping strategies. A group itself is a collection of people, whose association is founded or shared commonalities of interest. They have the same values, they have the same norms, and also they have the same purpose. So the membership of group itself, sometimes it was formed based on chance. You were born in that particular group, or choice voluntarily. For example, you choose to join this group of people, volunteer people. For example, Doctors Without Borders, Engineers Without Borders type of group, and sukarelawan and things like that. Or they become a member of certain group because the circumstances of life, for example, Persatuan Ibu Tunggal, they've lost their spouse, they become a single mother, and they found that a group of single mom would be useful for them. Or if they're forced by law. Yeah, this is one of the things that people form a group when you forced by law. For example, in the United States, domestic violence offenders, other than being served in prison, for example, for a short period of time, there are circumstances when the law requires them to meet each other to form a group psychotherapy so they can get some kind of treatment, intervention for what they have done. Okay. So continue with the group psychotherapy definition. So basically, group therapies intervention often highlight the way group feel members. You become the facilitator for the relationship and experience within the group members. You communicate and you form a relationship with one another. So basically, the biggest essence of group psychotherapy is the interpersonal aspect or interpersonal interaction that distinguish group psychotherapy from group therapy. When you are there in group, it requires you to interact more with your group members in comparison with individual therapy when you only interact with your psychotherapist uh, during the sessions. Okay. And the purpose of group psychotherapy basically to help emotional growth and personal problems. You have to understand Harry Stack Sullivan and also Bowlby when they when they uh, in their theory they strongly believe and influence also other than Sigmund Freud. They were also influenced by the work of Carl Rogers, and they strongly emphasis on emotional growth and personal problem solving. So the second one is that group psychotherapy basically help patients to understand themselves in the context of relationship, see the perspective from other group members, to learn more knowledge, to get more healthy, and to choose more adaptable choice based on awareness of how they feel, the feedback from the group members, reaction and pattern of their behavior. With the help of therapists as a facilitator, we point that out and bring awareness, to the patients about what they experience, how they can fix it, how they can improve it, and that validate their experience itself. Group psychotherapy also have been found to be a choice of treatment for certain form of depression, anxiety, isolation, anger, shyness, intimacy concern, and friendship troubles and work-related issues. I've done so many group psychotherapy work-related issues. For example, when they have issues with their bosses, they want to know whether the issues arise in workplace is something that they only themselves experience, or something that they can improve with a group. They can behave differently in a group, so the work environment will be more pleasant for them. uh, Basically, group psychotherapy, there's one single person, who's very famous on the work of group psychotherapy, Yelums. He have a few. He's been writing a lot of work on group psychotherapy, and he gave a few principle on how to conduct a group psychotherapy. One of them is one principle is that a universality. I put a notes over here so you guys don't have to write it down. Technically, when we do presentation, it will be a lot more better if less text. But since this is COVID-19 class, and I found out that putting more notes could be more useful for you guys. But so that there's more text, so you can understand. You can really refer after that, after we finish the lecture. So he said that universality is very important, in which we have to recognize the recognition of shared experience and feeling among group members will remove a sense of isolation, and will validate experience, and we raise self-esteem. Basically, universality principle tell each individual group member that you are not alone. The second one is altruism. It's helping, basically the helping principle in it with each other. This is where we as a therapist, we have to really train our patients in the group therapy, that group psychotherapy is actually a place where we help each other. We have to focus on that, to help the helping things with each other, help group members to feel the good self-esteem, to help develop more adaptive coping skills. They exchange ideas and interpersonal skills. For example, what you do when you have this experience, the helping, the word is here is altruistic character for each member has to be also implemented in group psychotherapy. Uh, the other principle, as listed by Yellows, is installation of hope in a mixed group. That we have various people from different experience. They are in a various developmental stages in recovery. Uh, we we encourage each member to inspire to other group members to overcome the problem. That's why when during the group session, we always ask each individual person to contribute and to respond to what someone in that group member said. When they share some issues, they have to give response, they have to inspire, they have to give hope. The number four principle is imparting information. We're not just gonna inspire hope. We're just not gonna talk about altruism, giving them helping uh, uh, behavior. We also have to impart some information based on experience. We hope that patient, the information, different people have different experience. The information they learn from each other can be more useful. Instead of getting from the therapist, they will say that you never experienced this, but when it comes, the information comes from each individual members, they would feel differently. Okay. For example, experience, group psychotherapist doesn't mean that they know everything, but each individual experience of person, they can share more useful information. The fifth one is that um, the other aspect is that you have to understand that in group psychotherapy setting is a professional group setting, and sometimes group members attach so much with the group individual group members and also the therapist. You have to correct that experience. This is a professional group setting. We are not your family members. This is what we call transference in group. In individual therapy, we call transference, and it occur also in group psychotherapy. So we have to correct that perceptions. Therefore, group psychotherapy remain as a professional helping group experience. Uh, the number six principle is developing socializing techniques. Some people, when they have remember what Harry Stack Salomon said, when people have a problem, one of the problem is caused by interpersonal skills, lack of interpersonal skills. In group psychotherapy also, we teach them to improve their interpersonal skills when we provide them a group setting or a group experience or an therapeutic experience when they feel safe and they get support. They take the risk to learn and relearn and to improve their skills in the group setting. That's include interpersonal behavior, improving their social skills behavior. The other skills or principle that we used to use to implement or the principle, a very important principle, is that imitating behavior. There's no harm for us as a facilitator or therapist, group therapist, to um, uh, to practice imitating behavior, in which we ask one of the group members to demonstrate, to show us, to the remaining group members, how are you doing this. That's what we call imitating behavior. uh, for example, you demonstrate as a group member, to demonstrate sharing personal experience, showing how do you become concerned, showing how you support each other. Okay. Number 8, the other important principle is cohesiveness. The group become meaningless if they are not cohesive with each other. So you have to create a sense of belongings, sense of acceptance, a great interpersonal skills, relationship environment among the group members, that will create a sense of safety, sense of confidence. When they have a group cohesiveness, and patients have more willing or to share their experience with you. Okay. And number 9, even though you are in a group setting, you have to implement a very important principle, in which the individual person have to take responsibility on their own life and consequence of one's decision. This is not group thing. Even though you learn from each other, the circumstances happen, but the consequence of your behavior has to be the individual one. And the other principle of group psychotherapy is catharsis. It's feeling catharsis when you feel relief. Dalam bahasa Melayunya kita panggil lega, from emotional distress, through free and freedom of expression of their emotions. This has to be practiced with the support of an audience of group members, and they can have relief from chronic feeling of distress, shame, or guilty. The other principle is interpersonal learning. Group members achieve greater level of self-awareness through the process of interaction with each other. And finally, group psychotherapy also has a principle of to help to promote self-understanding, in which you learn from different experience, and so you validate your own experience with others, and that as a result of that, you understand yourself better. Okay. So group psychotherapy can be used in addiction, in anxiety, depression, eating disorder, relationship difficulties, schizophrenia, self-harm, and obsessive compulsive disorder. Now, there are certain mental disorders that are not that useful for group psychotherapy. We call it contraindication. Antisocial, for example, antisocial personality disorder probably will not be appropriate to be conducted in group psychotherapy. Acute or severe ill cases like suicide tendency, when individual attention is required. Client with delusions. I have experience working with patients, patients who have delusional disorders. We try to do some kind of group psychotherapy. We combine with those who have mild delusion and also those who have acute delusion, it won't work. Yeah, and it's the same thing too, like detoxification patient who experience delusion and also paranoia and also hallucination. It's not really acute one. Yeah? It is not really suitable for group psychotherapy. Older age, low intelligence, unwillingness. So when group, for example, you have a group of domestic violence husbands, being forced to do group psychotherapy, for example, will be really, really challenging. It can be done, but it's not that useful from the what we have discovered in uh, studies, some studies. Uh, the other contraindication is that not everyone can do a group psychotherapy, even for qualified psychologists. If you're not used to do it, it's very difficult to do it, and then you try to do it, and it becomes not that useful to the process of patient's recovery. This is when we are lacking of adequate trained staff in handling group psychotherapy. Okay, so there are few advantages of group psychotherapy. More client can be treated at once. We gathered, for example, in a university setting, you have 18% of students who suffer from depression, and you've done your screening, and you want to make sure that every one of them are helped, so group psychotherapy is good. The second one, the group members hear from each other, from those who have experience about depression, for example. They themselves experience, oh, I'm not alone. So the experience is quite alienated to them. Now they become familiar because they hurt themselves. They other people experience it as well. And and patient can also uh, explore their communication style, in which they get feedback from the group members. And the other one is that members learn from other people how to solve problems, and they also learn from each other, uh, uh, some responsibilities and functions, and how they learn different cultural experience, and they when they want to do confrontation, for example, they can do it safely in a group setting. Okay, the disadvantages is that the privacy, uh, in the era of social media, group privacy is very difficult. You have to really emphasize on the group privacy, confidentiality, even though sometimes people, we reminded people many times, but especially when the group member knows each other, the temptation to disclose and to share that confidential experience is really high. And there are sometimes, even though you shed some symptoms, but the causes is different. Those who have causes from neurobiological functioning, for example, various diagnostic group can be more challenging when you want to do group psychotherapy. Uh, there are circumstances when patients come from a very different background, and their predominant problem is to express themselves, and it's not that easy in the first few sessions for them to change that behavior. That can also be a character uh, that reinforce other group member who have similar experience. So they say that, see, the guy also have the same problem, so I have these problems too. So they reinforce each other of strengthening the the poor behavior. Uh, Now, you have to be careful also. Sometimes when group members come from a very different background, some of them experience severe symptoms more than other people. And as a group psychotherapist, you tend to focus on them more, on that particular person. Then, without you knowing it, you neglect the other person. That can be disadvantageous also. When you neglect the other group members, it will have some impact on their psychological aspect in terms of in the process of recovery.